In the city that never sleeps, there's a new physician-staffed medical clinic that, well, doesn't sleep either. You are listening to ReachMD XM160, the channel for medical professionals. We all have a night owl, a night shifter, or an insomniac in our practice, but we also have patients who may be bothered by pain or illness in the middle of the night, but will avoid an ER visit at all costs. In New York City, at least, these folks have another option for late-night care now. Welcome to Clinicians Roundtable. I'm Dr. Larry Kaskel, your host. My guest today is Dr. John Chuey, senior physician at the 23rd Street office of the Beth Israel Medical Group in New York City, a 24-hour medical clinic staffed round the clock by physicians. Dr. Chuey, welcome to the show.
Hi, Larry. Great to be here.
Tell me a little bit about the clinic. How long have you been doing it, and what's so special about your 24-hour clinic?
Well, it actually was built upon a practice that has existed at that location since March of 1998. So it was originally a walk-in clinic, but we began offering appointments for preventive care and, chronic disease management. We began the program because we recognized a need to provide after-hours care for our patients and for New York City. A lot of people get sick overnight. They need immediate care. And a lot of people just have schedules that make it very difficult to get medical care during regular office hours.
Don't you have just acute care centers that are open 24 hours, or is this a different type of model?
In New York City, I'm really not aware of anything else like us. I think that we're pretty unique. I think nationwide, if you do a Google search, you'll find 24-hour clinics, places like Las Vegas and California. But they really offer just urgent care. We do some of that as well, but we also have doctors. We're board certified in internal medicine, family practice. So in addition to acute care, we can offer preventive care and chronic disease management. So we really can be a medical home for people.
So whose idea was it? Who didn't want to go home to their wife?
Well, I can say that, I work for Beth Israel Hospital. They own and run the practice. So the decision was made at the corporate level, but I would say that Dr. David Shulkin, he's leaving as our president and CEO, but, he's actually published a letter in the NAJM talking about overnight and after-hours care at the hospital, but also outside the hospital. Hennick, our senior vice president, he saw a need for after-hours care for us as well, and to be honest, for our bottom line, having those extra visits just never hurts.
Yeah, I would imagine if you can staff it, if you build it, they'll come. I think just getting people to work later hours, I think patients would love the access to care.
Yeah, that's very true.
So how did you staff it? How did you get people how many people do you need on the overnight shift?
Well, for the overnight, we have 3 doctors and 5 assistants. They work 12-hour shifts, but they basically rotate. So during one shift, there's one physician. They work with 1 or 2 assistants. The assistants do double duty. They both register the patients and also do procedures like phlebotomy and ECG. It's certainly different than what we have during the day when there may be as many as 3 to 4 doctors with many more staff.
It's less chaotic and less drama. So how many patients do you end up seeing? Or are they scheduled? Are they making appointments or walk-in or a combination of both?
During the daytime, we have both. At night, it's just walk-in. With one doctor, it's a little difficult to be able to schedule patients and also see walk-ins all at the same time. So in terms of volume, we probably average 15 to 20 during an average weeknight, and many more during the weekends. We may see as many as 50 on a Saturday or a Sunday.
Do you staff up for Saturday and Sunday nights, or is it still just one doc?
They're extended hours. So the Saturday, overnight shift begins at 3 o'clock in the afternoon, and it goes until 9 a.m. So we actually split those hours. So there's basically 2 shifts, so 2 different doctors work on a Saturday.
And is this a for-profit or non-for-profit center? Are you charging patients insurance, or you take all comers?
Oh, no, we're certainly for profit. We bill the insurance companies for those who have insurance. And, we bill by CPT codes. So, a level 1 for us, a 99201, might be $125 for a new patient. And it goes up depending on, things like complexity and if there's a procedure done, an IND or a laceration repair.
There's codes now for after hours, I think the 99050s.
That's definitely very true. I don't know how many payers actually will reimbursed for that, but I can see the incentive to, because we're certainly a better option for them than the emergency room.
You could definitely save them more money, but insurance companies aren't always making the best decisions. If you've just tuned in, you're listening to the Clinicians Roundtable. I'm Dr. Larry Kaskel, your host. My guest is Dr. John Chuey, a senior physician at the 23rd Street office of the Beth Israel Medical Group in New York City. And they run a 24-hour medical clinic, which is staffed 24 hours around the clock. Tell me a little bit about how much money this has actually added to the bottom line in revenue and or profit, if you know those numbers.
Well, I think it's a little too soon for me to say as far as profit. I can say that the startup cost was approximately $750,000, which it covers the cost of 3 physicians, 5 assistants, the extra operating costs. But our break-even point is probably about 140 to 150 patients a week. And we're pretty much at that point now. So we're reaching out to employers, to schools nearby, to managed care organizations to send us after-hours referrals. So, we expect that number to go up.
Right. I was going to ask, how do people even know that you're open besides word of mouth?
We're pretty visible. I think that we've gotten, quite a lot of press. The New York Times wrote up an article on us back in November. A lot of the local news organizations picked up on that, so they've done pieces on us. Article in Time Out New York magazine. We've done some outreach as well. We've contacted employers. We've contacted schools. There are a number of schools in the area, NYC, School of Visual Arts.
What neighborhood are you in?
We're in Chelsea. For those who don't know, Chelsea is the downtown west side of Manhattan, a very busy area, busy nightlife scene.
Where's that in relation to Times Square?
It's about a mile downtown of Times Square.
Do you ever do the night shift?
Actually, I haven't. I was one of the 2 original doctors who opened the practice, so I guess, I leave the night shift to the younger guys, but I'm there when they come in, and I often am there as they're leaving, so I do get to talk to all the staff about how things are going.
Tell me what you have learned about doing the overnight work that you really didn't anticipate. Are there people coming in with, too acute of a problem that you can't handle and you actually have to send them to the emergency room?
Yeah, that does happen once in a while. I think that, we had a couple of concerns here. Some people do come in with chest pains or acute abdomens, and that we do have to call 911 once in a while. We were worried about, sort of being open overnight and attracting sort of an unsavory element, people who are drug-seeking, the homeless, intoxicated people, but that really has not happened. There have been no incidents. As far as the work itself, it's interesting. It's created a little bit more work for the daytime staff in some ways. People might see the doctor at night, but they call during the daytime to get their test results, to get follow-up, to get PAs and pre-certs. And, we don't really know the patient, and it's hard to get the doctor on the phone, when they're off. On the plus side, it's actually improved our on-call availability. Instead of calling a doctor at home if somebody's in the emergency room or if there's a problem, they can call the office directly, and if they need to, they can come in.
Right, that is great. I mean, the doctors shouldn't have to get called at home ever if you guys are open all night.
That's a big plus for us.
Yeah. So are there any copycats? Are other doctors' groups wanting to do it? Because if you prove that the model works, then why not have every group do it if you can staff it?
I haven't heard of anything yet. I can say that our own hospital, Beth Israel, and our sister hospital, St. Luke's Roosevelt, is thinking about starting something like this uptown Manhattan. I don't know if any other hospitals in the city are thinking about it. What works for us in New York City certainly may not work in other parts of the country.
Right. There's not a lot of street traffic in Podunk, Iowa at midnight. What are you hearing from patients? Are they loving it? Are they thrilled?
Well, I think the feedback's been very positive. We're definitely a better alternative to the ER for anything non-life-threatening. For patients who were existing patients of the practice, I think they take a lot of comfort in knowing that we're here all night long.
And I assume it's 7 days a week?
7 days a week.
Is there a cost differential that the docs get paid when they work overnight?
Well, the doctors who work overnight get paid by salary, and the doctors who work during the daytime, the structure is more incentivized for them. It's probably not fair to fully incentivize somebody who works at 2 o'clock in the morning, for example. The volume just isn't there for that.
And is Beth Israel thinking about doing this with some of their other clinics and expanding the program?
We're thinking about it. I think that it wouldn't make sense for us to open another office like this across the street, but I think in other parts of Manhattan, uptown, possibly even in other boroughs in New York, it could work very well.
And then, for getting the doctors for a while, the staff, I would assume I would have to pay I have to pay them more when they work on a Sunday. So do you have to pay them a little more to work nights, or are they all salaried too?
The daytime and nighttime staff get paid about the same amount, although for the nighttime staff, they wind up working 3 shifts a week, which is a big advantage to working 5 days a week for everybody else, I think, in some ways.
Dr. Chuey, have you looked at any sort of cost comparisons as to, what it would cost a patient to come to you in the middle of the night with epigastric pain versus going to the emergency room and be able to actually show that to somebody who makes decisions that it would be of benefit to steer people your way?
We haven't looked at that, but I think to me, it's obvious that we charge what a typical internist would charge for an office visit, and an internist certainly charges a lot less in the emergency room, for everything, for, a doctor visit, for procedures, for everything. So I think that for anything non-life-threatening, if you have a sore throat and you're having a hard time swallowing, if you have that 2 a.m. bladder infection, why go to the emergency room for that?
What type of ancillary services do you offer in your office besides just blood draws? Do you do any imaging, any x-ray?
We don't do imaging in the office. I think that's one of the drawbacks of being there overnight. The lack of services such as radiology, laboratory services, I think, are limited, and specialty services. You can't really get a hold of a specialist late at night. So that's one thing that would certainly help the practice, just to have more of that available. There was X-ray in the office at one point many years ago, but to be honest, we took it away because it was just too costly to maintain. A lot of insurance companies just simply weren't reimbursing us for X-rays being done there.
So if a doctor's listening to the show and they're thinking of expanding their hours, would you say to them, give it a try? It's been financially successful, and there's no reason not to do it if you have the foot traffic.
Well, I think that if they're willing to put in the hours, I would give it a try. I think that there's certainly a demand for it from their patients. I think that even if you extend the hours to 8, 9, 10 o'clock, your patients would appreciate it. And as far as profitability, for us, we're in a prime Manhattan location. The overhead is tremendous in terms of rent. So any additional visits we generate would help to offset that. So that's really one of the main reasons we began the program.
And, I know you mentioned earlier that really you're the only clinic that you're aware of in the city of New York that has 24-hour facilities?
The only standalone. We're not directly connected to a hospital, so I'm not aware of any place else you can go 24 hours a day for this kind of care.
Dr. John Chuey, thank you very much for talking with us today.
Thank you.
My guest was Dr. John Chuey, senior physician with the Beth Israel Medical Group in New York City, and we were talking about the new novel 24-hour medical clinic that is staffed all night long by physicians. I'm Dr. Larry Kaskel. You've been listening to the Clinicians Roundtable on ReachMD XM160, the channel for medical professionals. ReachMD online, on demand, and on air. Please visit us at reachmd.com, and thanks for listening.